As of right now, there are over 2 million people in the world that are known to have this infection. COVID-19 is the disease. And at least 150,000 people have died so far. And we're not even halfway through this. In the US, we've hit over 660,000. Then that's with known cases of infection. And I'll talk about that in a minute. And at least 29,000 people who have died so far. And something to keep in mind with all these numbers. They're large and they're scary, but they also very much likely reflect an underestimate, because there are a lot of issues and have been complications since the very beginning with testing and a lack of availability of testing. And also, many people who get COVID-19 don't get very sick from it. And so they don't even need to go to a doctor or know to go to a doctor to get tested and get a diagnosis. We think there's probably somewhere between 5 to 10 times more people who have had the infection than the current numbers reflect. So it's very likely that at this moment in time, there's somewhere between maybe 3 and 5 million people in the US who've been infected. Now, the virus itself, I mentioned, certainly doesn't make everybody really sick. In fact, most people, when they get it, have very few symptoms. Some people don't even know that they've had it. They may have no symptoms whatsoever. When you have a mild case of it, then it doesn't really have any negative impact on your own health at all. And this is what happens particularly in kids and younger adults, in that severe complications are rare. However, when you count everybody with known infection, about 15% get sick enough where they need to go to the hospital. The people who are most likely to get really sick, to have complications, and be at risk of dying from this are first and foremost older individuals. So people over age 60 and 65. In fact, if people who are 80 years and older, when they get this infection, their chance of dying is about 1 in 5 or 1 in 6. And, in the 50 to 60-year-old range, it's about 1%, which actually is pretty bad. I mean, that's about 10 times worse than flu. And so what that means, even if our kids are doing fine, they're unlikely to get real sick from it. They definitely could pass it on to, say, grandparents. And there are some other things, people who smoke are more likely to have complications with this, and people whose immune systems are weakened, people who have chronic heart problems, including hypertension, just high blood pressure, very common, is a risk factor. And then also any chronic lung disease, things like especially bad asthma or emphysema or COPD. So every single person who's not had this infection before is at risk of getting it, but then we know for sure the people who are, if they do get it, that are more likely to be sick. Well, it goes from person to person. And that's really the most important way that somebody can get COVID-19, is to be close to somebody who has it. What happens when the virus gets infected in us, the virus lives up in the throat, in the mouth, the nose, and whenever we breathe or speak or cough or sneeze, there's tiny little droplets that come out of our mouths, and they have, and in a person with coronavirus infection, the virus lives in those little drops. And if you're within 6 feet of somebody, those tiny little drops can land on your face and then get into your mouth or your nose or your eyes. And then the virus that's in there has then now found a place to live inside of you, and then you can become infected. Now, what also can happen, though, is that some of that virus can then land on droplets that then contaminate surfaces that a person with infection is around. And so, say if they're at a desk and they're just breathing, coughing, talking, and they have infection, there's going to be a little virus that lands on the desk and other surfaces. Every one of the measures that we do is to try to prevent people being close together within 6 feet of each other, at all, but particularly for any length of time. That's why the social distancing measures for restricting gatherings. You don't get people together for group things. You don't, you stay at home and you're only going out when you absolutely have to. That's to prevent being within 6 feet of other people. We then also recommend cleaning of surfaces that is especially areas that are touched frequently, and even more importantly, washing your own hands. Since this is invisible and you can't tell what surfaces might be contaminated or not, and it's just not practical to go around with like a Lysol wipe or Clorox wipe and touch and clean every single surface that you come into contact with. That's not practical. But what you do want to do is be able to clean surfaces that you'll be working with a lot, and also high touch areas. And then more importantly, wash your hands, because that's something you can control. You can control how clean your hands are all the time by just frequently washing it, and then trying to make sure you never ever, as much as possible, it is pretty much impossible to completely do this, but as much as you can, think about never touching your face unless you've just washed your hands. The virus can live on surfaces for a couple days to a couple hours to a couple days, depends on the temperature and the humidity and also the kind of surface. For the most part, things like paper, cardboard, things like that, not a big risk as much. It doesn't live on there as much. A little bit longer on things like plastic and metal. But even still, it's super easy to kill this virus. So just routine cleaning with almost any cleaning agent, even soap and water, really does kill the virus on surfaces. And so even though it's important, certainly an important measure to help protect ourselves, the most important thing, though, is really staying away from people, especially within 6 feet.
This would be the ideal time then to be wearing a mask while you're with someone at work. What we do here at the health center, when I'm in my office completely alone, I don't wear a mask. But when I'm out going down the hall where I may then need to stop and talk with one of my colleagues or do something, I put on a mask. So while you may not need a mask in your own work environment when you're alone, if you can't guarantee that you're 6 feet apart from someone, both of you should be wearing a mask. And that can be a simple cloth covering. Again, we're thinking about, why are we using that mask? We're protecting each other. So yes, it could be perfectly safe for you to do those things that you have to do, taking that simple precaution.
In a hospital setting, there is a need for the most, the most protective kind of mask called an N95 or N95 respirator. That is really needed only even in hospital workers who are working with patients who are the very sickest and are the ones who are having things done that are spreading the virus into the air in large quantities. Like they're having procedures done that are, especially when they're getting a tube put down their throat to be on a breathing machine. That in that procedure, lots of virus gets out into the air. And that's like the most dangerous, the most likely way to become infected is if you're a healthcare worker and you're around a patient who is having these types of procedures done. And so for those who are at the very highest risk, the N95 respirator is very helpful for that. That's useful for that. Most people in the hospital, most healthcare workers taking care of patients with, even if they are known to have COVID-19, but they're not undergoing those procedures and they're not critically ill, then the surgical masks or isolation masks are used for those patients, for healthcare providers in the hospital. And that does provide some respiratory protection from it. Now, they also wear face shields too. For people who are known to have infection, the face shields are an important part to protect any virus getting into their eyes, okay? These are for people who are known to be infected and, have symptoms, and it's really important in that respect. Then there's the cloth masks. The cloth masks may provide just a little bit of protection for the wearer, but the reason that the CDC just last week, it was a week ago today, recommended that when people are out in public, when they have to be, right? They should be at home most of the time, but when they are out in public to get groceries or to get things from the pharmacy, or they have to be out, then to wear a cloth mask will help a little bit for them, but mostly just to prevent the wearer from inadvertently passing infection or spreading it to other people if in the small chance that they themselves are infected and don't know it. And so if you make a rule or a guidance that everybody should do that, that really helps the overall public health, because it reduces the chance that somebody with infection and they didn't realize it would inadvertently spread it to somebody else. Our health departments in the region have a a phrase that I think summarizes that pretty well. It says, my mask protects you, your mask protects me. And so it's a reminder that those cloth masks are mostly just to be able to prevent spread of infection from the person who's wearing it. Okay, so that's where the different masks come in. And in a hospital, it's very clearly laid out who needs them and who doesn't. So in our hospital right now, for example, if you're just kind of walking the hallways, but there's quite a few people walking the hallways, most people, would be wearing some sort of face protection, but it could even be just a cloth mask. When they're taking care of patients that are likely to have COVID-19 or known to have COVID-19, then they wear a surgical mask or an isolation mask. Or if they're, even working directly with the public a lot, so that have lots and lots of interaction with many different people. And then those N95s are just used for people like in the ICU and the emergency department who are seeing the really sick patients who are undergoing those procedures.
And I think certainly the cloth masks that many people are using now are made of materials that can be washed, and so those can be reused very frequently. The advice that we've been given as healthcare workers when we talk about our surgical masks is really that they can be reused. I mean, in the ideal world, when we're not conserving things, I mean, we throw away things all the time, and traditionally we know that these types of masks were meant for a one-time use. But absolutely in this environment right now, we are being told from the CDC and within our own hospital guidelines that we can reuse those surgical masks unless they become very soiled, very wet, or torn. And so what we've been doing is each night, as long as our mask is still quite viable and fine, we've been putting it in a paper bag with our name on it and using it again. So, for your own personal mask, that would be my advice. Look at it. If it's really visibly soiled or sopping, then you know what, it's probably time to get a new one if we're looking at the isolation ones, or if they're torn, of course. Cloth ones you can wash and reuse. And so I think that would be my advice.
If you use them anyway for a job, you'd still want to use them. That's for sure. And if you're going to be working on a space in an area that you're not sure that you can completely disinfect, it's not an unreasonable thing to use gloves in that case too. And that might be more of a consideration if, for example, you're going into a unit where somebody is known to have infection. And so either they're isolated or they're at risk of it. They're in quarantine where their risk of having infection might be a little bit higher. And there's going to be a lot of touching of surfaces. Then it's a reasonable thing to wear gloves during that. I definitely don't think it's a good idea to wear gloves out when you're out and about. Like, say, if you're going to the grocery store and wearing gloves, for a couple of reasons. One of them is that remember that gloves themselves can have, they can be contaminated themselves. And so if you're picking up some contamination either by, say if you have infection and you touch your face with gloves on, then your gloves are contaminated and just as likely to then contaminate other surfaces as bare hands are. In fact, maybe more so because some types of viruses and bacteria live longer on gloves than they do on hands. And so the use of gloves should be just for temporary jobs like that you're doing where there's potential exposure, and then you remove them and wash your hands. So hand washing is definitely important, and gloves are no substitute for that. Hand washing is by far the most important thing. But again, if you normally wear gloves for certain jobs, you would still do that. But to wear gloves for a job you wouldn't normally, mostly based on the likelihood of touching surfaces that has been in a place that might be more likely to be infected and can't be disinfected. Just like every other thing, the principles that we want to try to remember is that if it's possible for somebody in a living space and where repairs are needed, if it's possible for them to leave that space, that's what should happen. And for those who aren't on isolation or quarantine, that should be achievable. It should be possible for them to be able to leave that space while any of the work is being done. If it's somebody though that isn't under isolation and quarantine and they can't leave, the risk would be the risk would essentially be exactly the same if you hanging out with your coworkers. And if you can maintain 6 feet of distance, then there's very little risk. Now, you still do want to be able to, if you're going to be working on surfaces, to clean the surfaces that you're working on, and to make sure that but you don't need to worry about there being virus hanging out in the air. That's not going to happen. Even if they were known, even if they're infected and they didn't know it, it's not going to be hanging out in the air if they're not in that same space. So first and foremost, I guess the guidance would be, if they don't have to be in that same space, if they can leave the unit, that's best. If they can't, then to be 6 feet away. If it is somebody who is in isolation or quarantine and they can't leave, then it's then in that instance, then absolutely, then the work being done in there should be done with a surgical isolation face mask and actually some eye protection as well, and still keep the person at least 6 feet away. But there have been some, I don't know exactly what the end result has been, but I think if there were instances where there was known where there needed to be some maintenance or work done in a unit that was going to take a while, especially if it was going to take a while, that they were looking into being able to find another place for the person under isolation or quarantine to temporarily move to while that work is being done.
To be reassured from Dr. Lawrence saying that this virus is not, we call it aerosolized, that it is not hanging out in the air for hours and days after someone has just lived in an environment. We in the medical community aerosolize this when we're doing procedures, and that's why there's that extra level. But to know that if you must go into that space, we'd like you to have the protective equipment that's already been decided upon with the guidelines, but having that person 6 feet away, hopefully they have a mask as well, because people that we isolate, we give them masks to do just in this kind of situation, and that you as the worker going in with protective equipment is very similar to us in the healthcare system, to looking after these patients, as that's what we're doing, and we're in that close contact. And there really have not been a lot of healthcare workers using that particular type of protective equipment known to have been infected by doing that. They might get infected when they're, not doing what they're supposed to at the grocery store, but they're not, when you're using the protective equipment correctly, when you're getting that distance, we have not found that there have been many healthcare workers in that situation contracting the virus. And Dr. Lawrence can chime in or correct me if I'm wrong, but I believe that's what the studies are showing.
Oh, that's right. And actuality, though, I think an important addition to that, though, too, would be that, the kind of PPE or personal protective equipment that we use is based on risk. And you think of like 3 different layers of risk. There's the risk of being with a patient who's really sick, who has known infection, and they're having procedures done. Boom, that's the most, and if you're close to them, that's the highest risk. Then the next level of risk is being in close proximity with somebody who either is known to or is likely to have COVID-19 based on symptoms. That's the second level of risk, and that's where many of the healthcare workers fit into. This third layer of risk is much lower, and that is where there's somebody, if there's somebody in the same space that you have no suspicion of having infection, they're not in isolation or quarantine, it doesn't mean the risk is zero, but it's a low enough risk that, like wearing surgical masks wouldn't be necessary if you can maintain a 6-foot distance. And so that's why the PPE that's recommended is tiered based on risk. And so in most every instance where people need to go into a unit to be able to do some work, most every instance it would be low enough risk that even a surgical mask isn't necessary. But certainly if there's somebody who is, again, in isolation or quarantine, that's when you would end up ramping up the PPE a little bit based on a little bit higher risk. setting where there's known infection, there's a period of time where they let it air out, but it's not an extremely long extended period of time, and it depends on the kind of air cycles that are occurring. But that's even in the hospital setting where we know there's a sick patient that's having a lot of virus. So what I've recommended, and I don't remember if it's completely reflected in the guidance or not, is that if there is a space, say a room where a patient was known to have COVID-19, it would be reasonable to let it sit for a day before things are done, unless obviously it's really urgent. But otherwise, if the occupant was not known to have infection, then there would be no need to let it sit for any extended period of time before going in and doing cleaning it and prepping it for the next round. Now, I think it is still a reasonable thing to do for example, cleaning a room for turnover. I mean, it would be reasonable to wear gloves, but not necessary for like any mask protection, and not necessary to keep it open for to stay out of it for any length of time. So what happens when we get infected? Our bodies develop antibodies that then protect us from future infection, but we don't know yet how much protection that we get after somebody's been infected, and that's still up in the air. A vaccine does the same thing, right? It then induces or gives your body a chance to produce antibodies that protects you against future infection. But as of right now, we're not sure if somebody who's infected then has lifelong immunity, if they have immunity for a year, or how long that would be. And we don't yet have available the tests that tell us if those antibodies are there and would give protection. We're getting close. There are some tests that, first off, there have been some tests that have been released that are probably not very accurate, and they're not, we don't use them, and we don't suggest that people use them because they can give false results. The really good tests will probably be available sometime within the next month, but won't probably be rolled out to the point of everybody using them for months until there's enough of them. And that tells us who's been infected before, and then gives us a little bit of an idea who might be protected and not at risk for going back to work or in a work setting. How those are going to be used in the future to help to decide who can work where, and those types of decisions, we're in the process of trying to figure that out. But it's they're not ready for prime time yet, and we don't know exactly how well or how they're going to be used. But that probably is going to be a part of the process of how we do things after we emerge to this and start moving towards more normal operations. We are absolutely seeing a disproportionate impact in the St. Louis region, in that the 2/3 of the deaths and more than half of all the known infections have occurred in communities of color. And this is probably many reasons for this, but one of the main ones are that it's hitting communities hard who have traditionally had a lack of access to healthcare, who have had disproportionate the high rates of hypertension and other chronic medical conditions, oftentimes because of, again, not as good of access to healthcare, and also just all of the inequity that has occurred over decades in a lot of these neighborhoods of where people live. And so it is not, unfortunately, it's very not surprising that an infection that does seem to hit people harder, who have less access to healthcare and who have been had inequitable healthcare over decades, and also just other inequities that are related to job opportunities and just about everything in life, is that there is then an increased likelihood of causing infection. That infection will cause more serious symptoms. And so the other thing too is that many of those areas also are representing many people who are still working on the front lines and working in industries where there's instead they can't stay at home. They're actually working on the job and having to interact with the public on a daily basis. And so that puts them just from the job at a little bit higher risk as well. The truth is that nobody knows the exact right way to do this because the country, the world, hasn't faced this kind of problem for 102 years. And so none of us were alive then. And it was a much different society then. Many things were different. There were many things that, just don't exist now, or that do exist now. And so how we come out of this is something that there are a lot of principles that we understand. There are a lot of ideas and proposals. And what the truth is, though, is that some of these things we know will work, some we think will work, and there will be some trial and error as we get through this to figure out how to get back towards a more normal type of situation. But here's one of the things that we know, some of the things that we know. We're not going to get back to completely normal. We're not going to have society back to where it was 3 months ago for a long time. It's not going to be like that, probably for at least a couple of years. The other thing is that in the meantime, as we'll probably need to stay where we're at right now for a few more weeks. And this is reflected in the extension of the stay-at-home orders from the city and the county, in that we are making a difference. In fact, all of these social distancing measures have worked extremely well. Our hospitals are able to handle the patient load because of these measures. In fact, if you hear some people, you could hear some critics say, well, maybe we didn't need to do all these things because we don't have as many infections here, although 3,000 in the St. Louis area, that's, you could argue is a lot. And in reality, that probably means there's 2,000 cases here. And so far, there's been 100 deaths. So, that's nothing to, certainly diminish. But some people, when you compare it to New York City, not nearly as bad. And some people might say, well, it wasn't as bad here. Maybe you didn't need to do all those things. Well, that is a completely false logic. The reason it wasn't bad is because we did all of those things. In fact, it's very, it's certain that our situation would be much, much worse if we didn't do all these things that we're living through right now that's causing all of this disruption. And unfortunately, though, it's going to take a little while before we can start relaxing some of those things. But in all likelihood, sometime in the next month that, as things start to settle down and the numbers go down, then some of these things will be relaxed, but not everything. And how that's going to happen, we don't know yet. We do know that, it's going to be, I think, a long time before you're ever going to feel comfortable getting hundreds of people all together in the same space. That's going to be a while before we do that. But when, as far as getting back to a workplace setting where we can try to still keep our distance from each other, sometimes, wear cloth coverings in the workplace, over our face when we are in the proximity of other people, those things might still be necessary. Okay. But we don't know exactly how that's going to unfold, but we'll get through this. The key is going to be once we get an effective and safe vaccine. That is something that the timing is very difficult to predict. In the best case scenario, maybe we'd have one of those in a year, but it is more likely a couple of years before we would have a reliable and safe vaccine. And so that's why I think it's likely that we will be living with coronavirus, but not to the extent we're at now, but still with it, and figure out how to, we'll have a new normal of things that we'll be dealing with probably for a couple of years.
Where I always go, and that's the CDC. But we've got such incredible experts right here on our campus, and I think it's our job, both mine and Dr. Lawrence, to be sure that we're giving as much information as many times as we can, and in whatever way we can, to be sure that you are getting accurate information there. And I would say, as much as you can to come back to the experts here in our own community and the infectious disease folks that we have.
This is real. This is a virus. We know what viruses are. We know what they do. It goes from person to person. It can kill people. Certainly not everybody who gets it, but enough that it's a major, major deal. There's no hoax about this. And, quite frankly, the people who perpetuate those types of things either have a political agenda or they just want to cause disruption or get attention. but people who are in your community who you trust, right? And hopefully that is people who also have spent time thinking about this. They work on this problem. And certainly we've got a large number of people on our own campus that do that. But as Dr. LeBlanc said, the CDC, Centers for Disease Control, while they have not been had as much of a voice during this outbreak as they would in prior outbreaks because of the way the administration views them, what they are publishing is accurate and trustworthy. The World Health Organization is also trustworthy. I think when you start to get into different types of things where, you just have to be careful with different internet sources, with what comes out there, and kind of take everything with a bit of a grain of salt until you've heard, true experts who've been dealing with this and who are trustworthy, who can weigh in on it. And so I want to make sure everybody has the information, knows how to protect themselves, and then knows what's real, what's not, what to worry about and what not to worry about, so that you can feel safe, and as safe as possible, to feel comfortable and to be able to feel proud about the work that you're doing.
And I would say that if folks have questions, absolutely to bring them up to supervisors and they can send them to us. There are some questions I know that we haven't completely addressed from all the ones that were, Steve, Dr. Lawrence and I were really blown away by these questions. They're amazing questions, absolutely spot on and reflective of careful thought and what you're thinking and worried about. And I would say that of the ones we have that we may not have been able to address directly, that we will work together to get a written response back to your supervisor, so that you could, if that question of yours in particular we just didn't have time to get to, that you can feel that we did address it as well.